I guess there are lots of reasons why technologies become important in a mental health context. Some of the really significant barriers to young people being able to get the help and support they need include concerns around confidentiality, around stigma, feeling embarrassed or a little bit unsure around seeking help. Cost is always an issue, and access. And that could be geographic access. You might be in a rural or regional area and it's 3 hours drive to be able to access a support service, or longer in some cases. But it might also be that it's difficult to get an appointment in the area that you're in, or you may actually have a really specialised or complex case, and there may not be someone with that particular expertise in your community either. But what we know about technologies is that they can actually create the opportunity for people to have a bit more choice around the types of services and information they engage with, getting some different perspectives that may actually cross geographic boundaries. Anonymity can be really good for sensitive or really embarrassing health issues. We find that a lot in mental health, but also in sexual health, in drugs and alcohol, so substance use kind of issues. Fewer geographic or physical constraints. There are still some. And for people who have a disability and may require a screen reader, for example, to be able to engage in online content, there are probably still some advances that need to be made in that particular area. 24-hour access can be really important for a lot of people. The same goes for being able to access telephone services, but online services as well. Being able to actually receive immediate feedback in response to a question or a concern. And it also being a preferred medium for help seeking for a lot of people, just a lot less confronting than people might experience. So I just thought I would finish off, given, and I know I've sort of changed tack a couple of times between the mental health stuff and the safety stuff, and ultimately being safe online is actually about experiencing positive wellbeing and positive mental health, so it does tie in. I wanted to actually profile a couple of resources developed by partners in the Cooperative Research Centre to support people around safety issues, because it is often a question that we have when we talk at community events. Everyone's got a young person that they care about, whether that be a child or a relative or someone down the street that they're possibly worried about their engagement in the online environment. So I just thought I'd highlight a few of them, and happy to make this presentation available via Lantern for you to check the websites out for yourselves. Think You Know is a campaign that's actually been developed by the Australian Federal Police and Microsoft Australia around staying safe online. And the reason why the Australian Federal Police, as well as the State and Territory Police, have a particular interest in young people's safety online is because it's actually federal legislation around the use of a carriage service, which is a really fancy way of saying a mobile phone, and the internet, that I guess brings up some of those sort of legal challenges around using technologies. So it's actually an offence to use a carriage service or a mobile phone or the internet to harass or menace. And that's where you often see people talking about someone having been charged as a result of some cyberbullying occurring. But the Australian Federal Police are really keen to take a much more proactive approach and support young people around digital citizenship. So they've got a whole lot of resources available at their website, which is kind of exciting. The Alana and Madeline Foundation is a Melbourne-based national not-for-profit organisation that have actually developed a program that's operating in a number of schools and will be rolled out in Victoria and other states and territories over the next couple of years, which is really around providing a whole school approach to addressing issues around cyber safety. And it's really, I guess, in response to acknowledging that everybody needs to take responsibility for young people's safety online. And we know from strategies to actually reduce bullying in the face-to-face environment that it's actually about using a number of different strategies at a number of different levels within the school to be able to make an impact. So it's not necessarily about just targeting the young people doing the bullying or just providing support to the young person who's being bullied. It's actually about also providing information to parents, to carers, to teachers, to executive staff, and creating a positive environment within the school, which in turn reduces some of the risks and impacts around this type of behaviour. CyberSmart is the Australian Government Cyber Safety Program, not to be confused with the Police Cyber Safety Program. They're a slightly different area of government. It's led by the Australian Communications and Media Authority, which is a statutory body. And they have developed, again, a number of resources around cyber safety, but also have some really fantastic links up on their website to be able to, I guess, provide links and information to help people who are actually experiencing challenges online, but also develop an understanding of what's appropriate and what's not. And it's sort of targeted at young people from about the age of 12 and up. And finally, SOSO, which is a project that we're a bit of a fan of at the CRC. SOSO stands for Smart Online Safe Offline. And it's been developed by NAPCAN, the National Association for the Prevention of Child Abuse and Neglect, and is about adopting a social marketing approach to cyber safety. So social marketing is actually about using traditional forms of marketing as a way of creating behaviour change. It's been used in health promotion around a whole bunch of issues like obesity, diabetes, cardiovascular disease, smoking. So if you sort of remember things that, you know, TV campaigns, online banner ads, social media around those kinds of issues, they're more than likely part of a social marketing campaign. So this one is actually about using those strategies and applying them to a context around cyber safety. So they've got a really great website as well. It's soso.org.au. And what we're going to be doing over the next couple of years through the CRC is actually starting to evaluate what this means on a long-term basis. So because this is really quite a new area for a number of organisations, a lot of the evaluations that have been conducted have actually been quite short-term. So they've just looked at, you know, the types of messages that people took away from a campaign, whether or not they resonated with them, whether it changed their attitudes. But what this is actually trying to do is change people's behaviour over a long period of time. So really excited about seeing some of the results of that. So I guess finally, I wanted to just tell you a little bit about our new research centre, just because we often get asked questions around what does this actually mean and why have you received this very large sum of money to do what it is that you do. So I guess the issue that was highlighted before around there just being so much available online at the moment, so many different organisations doing really similar work or dealing with these challenges and not quite being sure about how to approach those, was something that really struck the team at the Inspire Foundation and a number of partners over a number of years. We've got a really significant problem to solve around the poor mental health and wellbeing of young people in Australia. As I said before, we haven't really seen those figures around help seeking increase over the last 10 years. So we felt that it was really important and about time to bring everyone together to do this in a really collective and cohesive way. We also felt that it was really important that whatever approaches we developed kept young people at the centre and responded to the needs of young people and created opportunities for young people to be able to develop solutions for themselves and for their peers. We also thought it was really important to reflect all of the collaboration that was already happening out there in the community, particularly between universities and community organisations, and to reduce duplication of resources. So at the moment, there's lots of organisations running around trying to pool resources and develop online services, and what we thought we could do is actually work a lot smarter by working together. Hence, the new CRC, which is in desperate need of a new name. And we're actually working at the moment on a new name and a new branding and identity framework for launch when we officially launch our centre in December this year. So it will not be called the Cooperative Research Centre for Young People, Technology and Wellbeing for much longer, because it does actually make it quite difficult when you answer the phone. It's quite a mouthful to try and fit in. It's led by the Inspire Foundation, which is the organisation behind the online youth mental health service reachout.com, which I spoke about before. And it brings together 71 organisations from across academia, community, industry and government. We did receive $27.5 million from the Australian government, but we also pooled $7 million of resources from community and health services, also from government and from commercial partners. And we had all of those 71 organisations commit a really significant amount of what's called in-kind support. So they've basically volunteered resources from their organisations and given them to us for free, which is lovely. We've developed a number of research programs, which is across the promotion of mental health, the prevention of mental illness, early intervention and treatment. And we kicked off about 8 weeks ago on the 1st of July. These are our partners. So these are a whole bunch of fabulous and exciting organisations around Australia, but also internationally in the US, the UK and Ireland, who do work dedicated to improving mental health and wellbeing for young people. So if you were ever in doubt that there are organisations in Australia committed to young people and their mental health and wellbeing, that's a fabulous list of them. And so what we hope to do over the next 5 years is to roll out national programs to enable young people to participate safely and confidently online, to support and equip young people to be able to shape their own futures, to support young people within their family context, so recognising that parents and carers and community play a really important role in ensuring the wellbeing of our young people, empower young people to take action on issues that affect them. And if we have time, I'm sure Bryony and Hugh will tell you about a fabulous conference happening on Friday that's all about supporting young people to create change. And to also strengthen the early intervention work that's being done by a whole bunch of organisations, including Headspace, Origin and others, to try and reach that 70% of young people with a mental health difficulty who don't actually seek help.